So this first item is formatted in probably the most traditional, most common way you will see a prioritization item formatted. And that's where we are having to identify the sickest or the most acute patient that we need to see first. So we always want to read our stem very closely. So it says the nurse should first assess the client who is obtunded, on hospice care, and is becoming restless, a client who had a cholecystectomy 2 hours ago and is reporting nausea, a client that has a peptic ulcer with a rigid abdomen reporting sharp abdominal pain, and our last client who had abdominal surgery 2 days prior and reports left lower extremity pain and swelling. So let's take a closer look at these options and look at our pyramid and see if we can figure this out. So first option is obtunded. Do we remember what that means? Obtunded is kind of lethargic. They're on hospice care and they are becoming restless. So this is where I'm going to go ahead and give y'all a really helpful test-taking tip for NCLEX. And that is, be very careful to not just latch on to a single word or finding and just run with it. And that is, a lot of times we worry whenever we see that a client's got a change in their mental status, because that can indicate a lot of life-threatening issues, such as stroke or hypoxia. But for this client, we have to look at the context, okay? And that's with any item, especially prioritization. We always have to be very careful to look at the full picture. This client is on hospice care. So do you guys think if we have a client that's on hospice care, which means they have a terminal illness and they're lethargic and there's a change in their mental status, do we think that is expected for a client that is on hospice care with the terminal illness? Especially as they get closer to the dying process. Do we expect a change in mental status and some lethargy or obtunded? So I'm seeing a lot of people say that that's expected. That's correct. So once again, when we look over here at our pyramid, that's an expected finding. So that's not a high priority. So let's look at option 2. We have a client with a cholecystectomy 2 hours ago reporting nausea. So remember, cholecystectomy is a gallbladder removal. And we just had this surgery about 2 hours ago and they're having some nausea. So do we think this is an expected finding? So let's talk about this. Anytime we have a client going to a surgery, typically they get anesthesia. And we know that one of the most common side effects of anesthesia is nausea. And then also we have a client that had a gallbladder issue, obviously, to warrant the surgery. And so just gallbladder issues alone can cause some nausea and vomiting. So for this client, that's also a pretty expected finding. So we'll put that also up there at the top. So you guys are loving option 3, okay? And I see a couple people I already identified the diagnosis, so I'm very impressed. So we have this client with a peptic ulcer. They have a rigid abdomen and sharp abdominal pain. So do we think this is an expected finding for a client with a peptic ulcer? So typically with a peptic ulcer, you can have some abdominal pain, but I'll tell you what's really concerning for me is this right here, rigid abdomen. So this is another helpful NCLEX tip. If you ever see the word rigid abdomen or board-like abdomen, that's a big old red flag that we have a life-threatening condition called peritonitis, which you guys have already identified, so kudos to you guys. So peritonitis, remember, is inflammation of that peritoneal cavity in the abdomen, and if left untreated, it absolutely can cause life-threatening complications. A lot of times we see shock, so we see tachycardia, we'll see hypotension, and it is certainly a life-threatening issue related to perfusion or circulation. So when we look over here at our pyramid, it's a circulatory issue. So far, I agree with you guys. I love 3. But let's take a look at 4 just to be safe. So option 4, abdominal surgery 2 days prior, left lower extremity pain and swelling. So anytime we have a client that had a recent surgery, typically they're not as mobile as they normally are. So you have some immobility. So anytime we have a client that's immobile, what are they at risk for? DVT, y'all got it. So with DVT, you will experience that unilateral pain and swelling. Now, this is where it gets kind of tricky because that is also a circulatory issue. So you might say, well, they're both circulatory issues, so which one is the higher priority? Well, we once again have to look at the context. So with the DVT, it is still just localized to that lower extremity, okay? We are not seeing any indication that it is a systemic problem at all. Whereas with option 3, with peritonitis, they are at risk for shock. So they're at risk for systemic circulatory issues, which is going to be a lot more life-threatening quicker. But let me tell you about when option 4 could potentially be correct. Let's say we have the same situation where we have a client with lower extremity pain and swelling who then suddenly reports a feeling of impending doom with difficulty breathing, with chest pain. What do we think's going on there? If we have a DVT and suddenly we have a feeling of impending doom, difficulty breathing, chest pain, PE. Very good. So we're at risk for pulmonary embolism. So if that was the case, that's either a circulatory or a breathing issue. And so that would be a higher priority than option 3. But that's going to lead us to another really, really important testing point, is that we don't ever add information. Now, one of my favorite pastimes when I was a nursing student is going down a rabbit hole when I would read answer choices. And I know some of y'all might struggle with that as well. But remember, the NCLEX is not trying to trick you, neither are we, so always take it for face value. If it just says left lower extremity pain and swelling, let's just believe them. Let's not start thinking about how it can turn into a PE, and that's technically a breathing issue. Don't do that to yourself. It's a good way to set yourself up for failure. We got it correct.